On today's episode of the St. Louis Pain Expert Podcast, I'm talking with Dr. Paul Mintken, a leader in physical therapy research and who is, by all measures, a high achiever. And yet he's going to share with us a very personal story about how he used mindfulness to overcome alcohol addiction and how you can use it not only to overcome addiction if you're dealing with that, but also to recover from chronic pain and live a happier, healthier life. I think you're really going to get a lot of value out of this episode. And if you do, please subscribe to our podcast so you get notified of future episodes. And now, on to the show.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I have with me here today Dr. Paul Mintken. He's a professor of physical therapy at the University of Colorado and has an incredibly active research agenda. He's involved in numerous studies. He's had over 50 peer-reviewed publications, and he's co-authored 3 eBooks, 7 book chapters, and won a whole slew of awards. So I'm really honored to have him here and take the time out of his busy schedule. So thank you, Paul, for being here today.
Well, thank you, Dave. It's an honor to be here and share a little bit about my story and maybe something I say helps somebody else, and that's the whole purpose.
Well, yeah, Paul is, as you can tell, a very busy man, but we're going to be talking today about mindfulness, about taking time out of the day to just be present in the moment and how that can help a whole lot of different things, from chronic pain to addiction to any other slew of problems. And so Paul's going to share with us some information, but can you just tell us a little bit about yourself? I covered the basics, but just personally, professionally, what do you enjoy and what do you do at the University of Colorado?
Yeah, so I grew up in Colorado, played a lot of different sports, including football and basketball and rugby, and have the scars to prove it. I went to undergraduate at a small school called the University of Northern Colorado, which is up in Greeley, and got my degree in kinesiology. And then I had to make up a decision, do I want to go to med school or PT school? So I applied to both and got into both. And, I had shadowed 3 physicians and 3 physical therapists, and I asked all of them, if you had to start over and do it again, would you? And all 3 of the PTs said, absolutely, I love my job. And all 3 of the physicians said, hell no, I wouldn't do this again. One of them told me, if you work as hard at becoming a physician as you do at anything else in life, you'll make more money. So if that's your goal, this is not the route for you. They just were dealing with all the bureaucratic red tape and things like that. So I decided to go to PT school, graduated from the University of Colorado with my master's in 1994, and then worked full-time as a clinician for about 10 years. And decided I needed to renew my skill set. So I went back and did my transitional doctorate and did some fellowship training under Tim Flynn at Regis in manual therapy. And at that time, I was offered an academic position at the University of Colorado where I got my degree. So I took over the musculoskeletal content. And so I've been doing that ever since. I still remain clinically active. Obviously, with COVID, that's been inhibited quite a bit, but I'm typically in clinic 12 hours a week or so, and teaching pretty much full time, and then research is kind of a side hobby, but that keeps me incredibly busy as well. So,
well, you're certainly an accomplished man. Can you tell us, you presented at a conference, and that's kind of where we met a couple of years ago. You presented on mindfulness. Can you tell us, describe for people really who don't know what it is, kind of what is mindfulness, and how did you kind of come across that?
Well, the best definition of mindfulness is from John Kabat-Zinn, who's really the pioneer that brought it to the West. And basically his definition is, paying attention on purpose without judgment. So that means just tune in to what's happening, right now. We all get so busy worried about what's going to happen tomorrow or what happened yesterday that we forget that we need to tune in to what's going on right now. So how I got into it, when I first took over teaching in academia in 2004, I was co-teaching a class with a guy named Chris Lalich, who was an amazing clinician, went through the fellowship at Kaiser in California. And I just learned a ton from him. And, he was teaching at the spine portion of the musculoskeletal track, and he'd had leukemia in the past, but, he'd recovered and was doing well. And then, like halfway through the semester, he started to not feel well, started to lose weight, have night sweats, things like that. And so I think he knew something was up. And, he went in and saw his oncologist, and the leukemia had come back, and it was not looking good. And he passed away within a few months after finding that it had come back. And his brother was speaking at his funeral, and he said, right before Chris died, we were sitting there chatting, and he said, all these people driving around in their SUVs, sipping their lattes, they're all asleep. And right now I am so awake. And that was like a thunderbolt from God to me that said, why does it take a terminal illness to get us to pay attention, to tune in to the present moment, to appreciate what we have and not worry about all the other shit that happens in life, So that really made me think. And so I dedicated myself to paying attention every day. I would set timers on my watch, and then every so often I'd just slow down and I'd sit down and look at a tree and do some deep breathing and, try and, just tune in to what's happening right now. And so that changed my life. And, we'll get into, my drinking and alcohol and things later on. But I really think that saved my life at that point, because it allowed me to not get so caught up in the consequences of being an alcoholic. But then in 2007, my wife got this great job in Alabama as a vice president. And so we weren't sure if we wanted to relocate there, but I had this faculty position. Things were going well. I was moving up the ladder. So, her company kind of offered to offset my costs of commuting. So every week for 2 years, I flew down to Alabama and then flew back. And we had 3 young kids at that time. And, as you can imagine, it was impossible to juggle all of those things and be effective, efficient, and happy. So a friend introduced me to Eckhart Tolle's book, The Power of Now. And, I had it both in print version, but I also had it audio, and I just listened to it nonstop. And, he brings all of the spiritual components of mindfulness and meditation into a digestible approach. And it's not, specific to one religion or that type of thing. It just teaches you to tune into the present moment. And, one of the quotes he said, he says, realize deeply that the present moment is all you ever have. When you die, it will be now. And that, again, hit me just like the story of my colleague, that, we need to tune into what's happening right now. This is where life is. Life is not tomorrow. Tomorrow is just a thought, and when tomorrow comes, it's now. So, I just really embraced that and tried to integrate that into my daily practice of things. So that was kind of how I got into mindfulness.
Well, thank you for sharing your story with that. Now, you did kind of touch on this a little bit, but you mentioned you had struggled with an alcohol addiction. And how have you used mindfulness to help get over that and each day choose not to drink?
Yeah. So as far as the alcohol goes, I think I was a typical college student. I was a binge drinker. I would go through all the week and not drink, but then Friday, Saturday, I would cut loose. And, once I went from being a full-time clinician where every day I blocked out an hour and a half to go to the gym, I just made time for myself. As soon as I got into academia, that went away. I just stopped paying attention to myself physically. I was still practicing mindfulness here and there where I could, but I totally stopped taking care of the physical part of myself. And so in academia, Julie Whitman, one of my mentors, has a saying: in academia, it's like getting on a treadmill. Once you get on the treadmill, you can never stop running. Your plate is never clear. Like in clinic, when you can do your notes and go home and you're done, in academia, there's always something else that needs to come on. So alcohol became kind of a release for me. I never drank at work. I made it a point not to drive after I'd been drinking, because I'd seen the wreckage that drunk driving can cause. And I tried my best to not let it interfere with my work. I never canceled a class that I was supposed to teach because, I was hungover on hundreds of days, but, I made it a point to not let it affect that. But it was always on the verge of being out of control. And so mindfulness, I think, is the only thing that helped me keep it together during that time. I was very productive. I was doing a lot of research. I was moving up the ladder. I got promoted to full professor. I won a lot of different awards and things like that. And I owe all that, I think, to being in the present moment. And the other thing that framed my mindfulness approach was I watched that movie, Pay It Forward, and Julie Whitman was really big on that. If I spend time and I teach you something, you need to pay it forward and pass that on to somebody else. So in my life, I made it a point to try and do one thing every day for somebody without expecting anything in return. That could just be opening a door. It could be, helping a colleague out, or, reviewing a paper, whatever it was. But and I firmly believe that the universe rewards that kind of behavior. If you give more than you get, you'll get rewarded in life. So so that helped me kind of keep it together. And the thing that kind of pushed it over the edge was my father passed away. And that was a really hard thing. I had the proverbial mortality check. Someday you're going to die, right? So I started drinking more, got more out of control, and it came to the point that, I was fine if I wasn't drinking, but as soon as I had that first drink, as soon as I had one drink, I was not able to stop it. And, there's an old saying with addiction: when you get hit by a train, you don't get killed by the caboose, you get hit by the engine, and that's what kills you. And that's how it is with alcohol. That first drink, when it gets to that point, is the deciding factor. And, I'm convinced, in looking at some of the research, that it's neuroplastic changes that happened, all the neuroplasticity stuff that's coming out. I think that addiction, really grooves those pathways, that once you take that first drink, it just creates a cascade of physiological effects that doom you to kind of moving down that path. For some people, not everybody's like that, but I could not drink like other people. So outside, I looked successful, but inside I was dead. Spiritually, I was dead inside. So what saved me is I finally woke up one day and looked in the mirror, and I said, I can't do this alone. I said, God, universe, whatever is out there, I need help. And, I've seen that there's something going on behind the scenes. And, I don't claim to be super religious or that kind of thing, but I know there's a power greater than us operating in the universe. And whether it's sentient, I don't know, and I don't care. I just surrendered that day and said, I need help. I need to stop. So I reached out for help, and, the rest is history. I kind of turned it over and said, I don't have any control over this alcohol anymore. And so if I just turn it over when I have those thoughts, combined with mindfulness, being present and making decisions by being conscious about them and not just automatically, which is what happens in a lot of addiction. It's just automatic behavior that gets stimulated. That's really how it helped me kind of pull out of that nosedive.
Well, it takes a lot to come over an addiction like that and to give up that control and put your faith in a higher power, or the universe, or God, or whatever term you want to place on it. And I mean, it takes even more to talk about that publicly. So thank you for sharing that and for giving more information, or for giving more today than you're probably receiving out of this. So yeah, I appreciate your openness with that. For someone who's struggling with an addiction and they know they want to stop, that they haven't quite had that aha revelation moment that you had, but they know there's a problem and they want to start to take some steps to improve it. What are some things that they could do?
Well, the first thing is you have to kind of get honest with yourself. And, with any addict will tell you that, everybody around you can tell you that you need to quit, but you need to decide that you're going to quit. And you can't decide that you want to quit for your wife or your kids or that kind of thing, because that doesn't work. You've got to make the decision personally that, for me, I need to quit. You need to admit you have a problem, realize that you can't do it alone. Because I've quit drinking 1,000 times in my life. I've got up the next morning and said, I am never going to drink again. But then, you go back to it. So you have to kind of find humility and realize that you're not the center of the universe and kill your ego. So you have to just admit that you need help. You need to reach out for it. I think it's useful to tell somebody about it. So either a loved one or a friend. I had some amazing friends that, I constantly told them, I'm struggling. I'm not having a good time in life right now. So, once you make that decision, and that's the biggest thing, you have to decide if you've gotten to a point where you can't do this anymore. And until you get to that point, you can beat people over the head, you can have interventions and try and scare people straight and that kind of thing, but you really have to arrive at that decision yourself. And then once you do, you need to find a treatment program that works for you. There's tons of different things out there. There's rehab, there's self-help programs, there's 12-step programs. There's lots of books that you can read, things like that. But recovering from addiction is much easier when you have people you can lean on for encouragement and comfort and guidance. Because without support and accountability, somebody else knowing that you're going to stop, it's easy to kind of fall back into those old patterns when the road gets tough. So, there's a lot of different resources for addictions. There's helpguide.org, www.helpguide.org. Also, the government has a program, Substance Abuse and Mental Health Services Administration. They've got a website, just www.samhsa.gov, and there's a ton of resources there. And you can kind of just dip your toe in the water and see if it's something you're ready for. But as I said before, if it's not a decision that you've come to in yourself, in your soul, then it's probably not going to be successful.
Well, thank you for those resources, and we'll put those in the show notes so that people listening to this can go and find those if they do have some interest in it. And I assume those work for any types of substance abuse, not just alcohol, but whether it be
opioids,
tobacco or opioids or.
Yeah. I just testified 2 days ago we're trying to get a bill passed in Colorado that would require insurance companies to provide 6 sessions of physical therapy without copay as an alternative to an opioid addiction, or taking an opioid for pain, that kind of thing. It's interesting, the emergency departments, just like we're seeing all this COVID stuff going on, because people are locked at home, they're way more likely to abuse alcohol or abuse drugs. And one emergency room physician has seen a 1,000% increase in overdoses from opioids since COVID started. So, it's not helping the problem overall. And, I think that physical therapy is a viable alternative. If if we can see those patients before they see anybody else, and not to knock primary care physicians, but they don't know how to treat musculoskeletal conditions by and large. And, whether they send that patient to get an x-ray or prescribe them a pain medication or send them to see a surgeon, that old saying, when you're a hammer, everything looks like a nail. And that's kind of how you approach things. And Tim Flynn's big on saying, where you start is where you end up. So if you start with a PT, you're probably going to end up with conservative care. If you start with, a medical provider, you're going to probably go down that road. And so we testified to try and get that approved. We'll see how it goes. It got vetoed the first time through, but that would be great for patients to be able to come and see us directly. I mean, the amount of literature that shows that seeing a PT early is beneficial, not only for preventing opioid prescriptions and misuse, but patients just have better outcomes. They have less imaging, less surgery. Their outcomes are better down the line, and it's cheaper for everybody involved. It's cheaper for the patient. It's cheaper for the insurance company. It's cheaper for society. So that was an honor and a privilege to be able to present for our profession on that. So.
Well, thank you for doing that, and thank you for sharing some of that information for people out here in Missouri and other parts of the country who probably won't ever get a clue of what's going on in Colorado. But there are some similar approaches out here to try to get earlier access to physical therapy for people suffering with chronic pain. Now, kind of any other take-home points that you would give people if someone's dealing with chronic pain or somebody is dealing with a substance abuse problem? Are there any kind of summary points that you would mention?
If you look at mindfulness for treating chronic pain, there's 16 systematic reviews. So there are literally hundreds and hundreds of studies. John Kabat-Zinn was one of the pioneers, and back in 1985, he studied 90 chronic pain patients and trained them in mindfulness. And he saw significant reductions in present moment pain, negative body image, mood disturbance, anxiety, depression, and they decreased the amount of pain-related drugs that they were taking. And since that study, there have been just hundreds and hundreds of others. And as you know, pain is a complex experience that consists of sensory, cognitive, and affective elements. And so when we first experience pain, we immediately begin to judge it as bad and as something we want to stop. And then we start to explore all these ways to escape the pain, to find any solution we can come up with, all the while continuing to judge this experience as negative. And how mindfulness helps is it helps you tune in to the present moment and take, honest stock of what's going on, inside your body and that kind of thing, rather than, pain is out here and you're over here and you're fighting it all the time. You can become one with it and really tune in to what's going on. And, one of the strategies I use with my patients with chronic pain is have them visualize their pain as a campfire, and it's burning and glowing and that kind of thing. And through mindfulness, through some meditation type practices, I have them focus on that and focus on decreasing the flames. So using their awareness and their consciousness to try and turn down the flames. And, I've had really good success with patients being able to decrease their present moment pain, because there's a lot of research that shows that mindfulness is really effective at doing that. And it has effects on the brain. It causes structural changes in the brain, both in the frontal cortex and in the amygdala and the thalamus and the hippocampus. So I know I'm not supposed to use medical terms, but there is hardcore science that shows that mindfulness is very effective at changing the perception of pain. And one researcher actually found that the reduction in both the intensity of the pain and the unpleasantness of the pain was greater than opioids. Typically we get a pain reduction with opioids of about 25% to a painful stimulus. And in this study, the mindfulness was greater than 40%. So, the great thing about mindfulness is all you have to do is tune in, just pay attention. You can't do it wrong. If you sit down and just pay attention to what's going on, whether that's through, monitoring your breath or just looking at a tree and putting all of your awareness on that tree and realizing that you are part of this bigger universe. We're all connected. If you can tune into that's mindfulness. If you go for a walk and you put your cell phone away and you just pay attention to what's going on around you, the sounds and the sights and the smells, that's mindfulness. You don't have to sit on a cushion like a monk and hum and that type of thing. Mindfulness is just being present, being aware. So that's what I'd say about that.
Well, yeah, the way you described it at the very beginning here, just paying attention to the present moment on purpose is a great, easy way to sum that up. I think you also mentioned the Buddhist Zen type meditation, that a lot of people kind of see mindfulness in the public eye as something that's alternative or, weird, but there's a lot of hard science behind it. It can be integrated into Western medical practice and daily lifestyle practice, really. So,
yeah. Think about it. The present moment is the only time you can learn anything, that you can love anybody, that you can feel anything, that anything ever happens to you. And again, that Eckhart Tolle quote, when you die, it will be now. So, stop worrying about tomorrow. Stop worrying about yesterday. I mean, the Lao Tzu, I think, had that quote: if you're living in the past, you're depressed. If you're living in the future, you're anxious. If you're at peace, you're in the present moment. And I had a patient say to me one time, his layman's version of that is, if you've got 1 foot in yesterday and 1 foot in tomorrow, you're pissing on today. So I love that.
That's funny. Well, thank you again for your time today, Paul. If there are questions, or if people wanted to reach out to you, do you have any publicly available resources for people to reach out?
Yeah, I'm on Twitter. It's just at Mintken DPT. And if people want to reach out to me about addiction or chronic pain or that kind of thing, I mean, obviously you're an expert in this area as well, but my private email is Mintken, Mintken @comcast.net. And there are some chronic pain resources. There's the ACPA.org is really good. And then what I've been using a lot with patients, I don't know if you're aware of David Hanscom's work, but he's a former spinal surgeon who just got tired of seeing all the train wrecks with, multiple back surgeries and things like that. He's come up with a book called Back in Control, which is a self-guided program for dealing with chronic pain. And he's got a great website. It's just backincontrol.com. And it takes you through all of the steps, and it talks about mindfulness, and expressive writing is another tool that I've found is really powerful, both personally and for my patients as well. But it's got a step-by-step program to kind of regain control of your life. And, and I'm not trying to sell his books. I don't get any kickbacks or anything like that, but I've really found it's a user-friendly way to approach managing chronic pain. So.
Yeah, anything user-friendly is great. And I'll get all those links off the recordings and put those in so people can access them as well. But thank you again for your time and sharing your expertise and your personal story, and being a little bit vulnerable out here in public for the benefit of others. So keep doing all the great stuff you're doing in research and practice and just helping people.
All right. Thanks, Dave. And I appreciate all the work you're doing too. You got to do this together. So
that's right.
Yep.
Have a great day.
Okay. You too.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.